My name is Dr. David Rich. I'm the president of Mount Sinai Hospital in New York City and also Mount Sinai Queens in Astoria, Queens.
I am Dr. Sherry Young. I am a family physician by training, and I am the new cabinet secretary for the West Virginia Department of Health.
Hi, I'm Christine Schuster, president and CEO of Emerson Health System located in Concord, Massachusetts.
We live in a section of New York which is just north of 96th Street, which is the dividing line between the zip code that has some of the wealthiest people on earth and the area where we live, East Harlem, as an organization, has some of the poorest people in the nation.
For West Virginia, we have about 1.8 million citizens, and we have very unique healthcare needs, and we have a very unique geographic layout for West Virginia. We're very proudly the mountain state, but we have large cities or large towns by comparison, but we also have very rural areas.
The populations we serve vary from well-insured families to large migrant populations in several of our large communities.
Being on that fault line between rich and poor has been always Mount Sinai's, I think it's a joy and challenge at the same time, because we were founded as a philanthropic organization in the mid-1800s for people who had no other access to care. So providing care for everyone has always been part of who we are.
So when we address healthcare needs, whether that is from a population health or a public health perspective, we have folks that are 45 minutes to an hour away from any major medical centers. That means that we have to employ our Office of Emergency Medical Services, making sure that people are met with their needs where they are in their communities.
To serve these populations, especially the migrant populations who are new to the United States, we are focused on providing culturally sensitive care and really understanding their care expectations so that we can make sure that we have a great experience with them in our system. So in many cases, they enter our system through the emergency department, urgent care, or maternity services, and we are set up to care for them according to their standards and expectations when they come to our system.
We would love to evolve into a health system that is on the cutting edge of health system redesign.
For healthcare innovation in the state of West Virginia, in 2023, our legislature took the Department of Health and Human Resources and created 3 new organizations. So that is one of the organizational changes we are leading the way for in West Virginia.
We also have a big focus on health, wellness, and prevention. So we do a lot of screenings because we'd like to try to catch things before they become larger problems.
If you are admitted to the hospital for, let's say, an abdominal operation, normally you'd stay for 5 days. Wouldn't it be amazing if you went home after 2 days and spent the last 3 days in your own home, got the intravenous therapy, antibiotics, we could do blood testing, all the things that we need to do. But then the hospital becomes more efficient to run because you could do more of those operations and the patients would have a better experience.
We've split into the Department of Health, for which I get to be cabinet secretary and work with our public health and population health folks. But we also have 2 other distinct departments, the Department of Human Services and the Department of Health Facilities. So we are rearranging, reorganizing, and changing the way that we are addressing healthcare needs in the state of West Virginia.
If you do have some kind of problem, you can enter our system through urgent care, which we offer both in 3 physical locations as well as virtually, through our emergency department, and we have a full hospital of inpatient services, which we provide over a wide range of specialties and services. We also care for patients at end of life and have a robust palliative care program as well.
Think of it also for someone from East Harlem who comes into our emergency department. Wouldn't it be better if we could admit them directly to their home or send them home from our medical floor beds 2 or 3 days sooner?
So when we care for our patients, we put them at the center of all we do, and we really try to meet them wherever they are on their health journey.
But if I had to summarize the way we need to transform, it's to move care away from inpatient settings into other settings where we can provide the care people need at the same or even improved level of quality with a better patient experience and better outcomes.